tendon or muscle injuries, exposure to wind and cold attack, or obstruction of Jingluo due to damp evil. It can also be due to external trauma, which injures the Jingluo in the shoulder area and blocks the circulation of qi and blood. In the early stage of the disease, shoulder pain and limited movement often appear on one side of the shoulders. For both shoulders to be afflicted at the same time is rarely seen. The pain can affect the neck and extend towards the shoulder, or in some cases, it manifests as general pain extending over the whole shoulder area. This disease is characterized by stationary pain, worse during the night, and alleviated in the morning after some deliberate movements or exercise of the shoulder. The pain affects such movements as lifting, abduction, adduction, and posterior extension. In the early stage, it is mainly manifested as pain, whereas in later stages, it mainly manifests as shoulder dysfunction. Patients feel extensive tenderness around the shoulder under pressing massage. Here we introduce 3 treatment protocols. They are Acupuncturing method on selected points along the meridian combined with Asher points, local points, and distal points. Treatment according to selection of points along meridian accompanied with Hogel acupuncture method on Asher points. An Asher point is a tender point. It can be one or several points. Acupuncturing method is to insert the needle into an Asher point first and lift the needle to just under the skin when the qi arrives. Then insert the needle towards the left, right, back, and forward, and when the qi arrives, lift and pluck the needle, followed by withdrawing the needle. Don't leave the needle in. Select a number 28 1.5 Cun needle. Puncture the points along the meridian, leaving the needle in for a while after the arrival of qi. Meanwhile, have the patient gently move his shoulder in different directions. Then apply Acupuncturing method on the Asher points. Do not leave the needle in. After removing the needles, have the patient move the shoulder again. Each treatment lasts about 30 minutes. Based on the relationship between the tender areas and the meridian pathways, the shoulder B syndrome is also divided into the following 8 types. Hand tie-in type. This manifests as pain at the anterior part of the shoulder. It radiates a pulling pain in the Chepan area, or medial anterior border of the upper arm, and it can extend to the thumb. The shoulder movement is limited. Prescription: 雨季 Asher穴 语记。To treat, puncture 语记 of the long meridian of hand tie-in. Apply Acupunctura method on Asher points.